Hello everyone, welcome back to Dr. Blessing's platform on health issues. Today my focus is on tuberculosis. Tuberculosis. Tuberculosis is caused by a bacteria known as Mycobacterium tuberculosis. Following estimates from World Health Organization from 2021, it shows that 1.6 million people died of tuberculosis, in which 187,000 people were those suffering from HIV/AIDS. And still, the 2021 statistics, it shows that 10.6 million people fell sick during that period of tuberculosis, in which 6 million were men, 3.4 million were women, and 1.2 million were children. Multi-drug resistant tuberculosis is of a public health threat worldwide. And as you know, tuberculosis is an infectious agent. Tuberculosis is found globally. Tuberculosis does not respect age group. Tuberculosis can affect both men, women, children, irrespective of your race, irrespective of your age. Tuberculosis is entitled to affect everybody. And now, where are the various areas that you might be suffering or that can be affected with tuberculosis? You have your the kidney. Tuberculosis can affect your kidney, it can affect your lungs, it can affect your brain, it can affect your spine, and even your skin as a whole. You can still be suffering from tuberculosis. Now, tuberculosis, when children during childbirth, there is this vaccine that used to be given for children known as BCG. BCG. BCG is given to children at that stage to prevent tuberculosis infection. Tuberculosis infection. But it is also you should also know that the BCG vaccine does not prevent tuberculosis inside the lungs, but it prevents tuberculosis outside the lungs. So once as an individual you are infected with tuberculosis, the BCG vaccine cannot go a long way to prevent it because the tuberculosis is inside the lung. Following the statistics from WHO 2021, it shows that tuberculosis is a leading cause of death. 13 leading cause of death globally, and the second killer or infectious killer in the world globally, after COVID-19, tuberculosis follow. But now, looking at what is happening in the world today, so many people have forgotten about tuberculosis, and our concern is about COVID-19, HIV/AIDS, hepatitis, and so on. Please, 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 we should not neglect tuberculosis. There are so many people who are dying of tuberculosis. And how will you know that you are actually suffering from tuberculosis? You begin to have visible signs and symptoms such as cough, such as weight loss, chest pain, and night sweat, high fever. You begin to have some kind of abnormality. When you begin to have those signs and symptoms, please rush to the hospital for a medical diagnosis. And I want you to know that tuberculosis can be prevented, and also it can also be cured. So tuberculosis is not a disease that cannot be prevented. It can be prevented, and also it can be cured if and only if early diagnosis is being done. So when you have the visible signs and symptoms, please, it's advisable you rush to the nearest hospital to do a tuberculosis test, or the laboratory personnel or the hospital might do what is known as tuberculosis skin test. It's one of the tests that can be used to know that you are suffering from tuberculosis. Please, I'll be giving you a lot of information about tuberculosis, but let's be aware that this disease it is airborne. It can easily be transmitted from one person to another. We call it communicable disease. It can easily be transmitted from one person to another, especially in the crowded environment. And since it's an airborne infection, please, 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 when you find yourself in a crowded environment, people may easily spit, some may easily cough, and please, we should be able. That's why nose mask or face mask is very, very essential when you are in a crowded environment, because you may not know who is who or who is the carrier of the bacteria. But really, there are some people who carry the tuberculosis bacteria, but it becomes asymptomatic. That means they have not yet shown visible signs and symptoms. At that stage, the mycobacterium tuberculosis cannot be transmitted from one person to another because is still asymptomatic. Until when it becomes symptomatic, that you see visible signs and symptoms, that is when it can be transmittable from one person to another. Please, let's try by all possible means to go in for tuberculosis diagnosis, because if you go to the hospital and you are being diagnosed that you are suffering from tuberculosis, it can easily be prevented, and at that initial stage it can easily be treated. We should know that tuberculosis tends to be a fatal disease if care is not taken or if treatment is not done at that early stage. Please, this video is just to create awareness about tuberculosis. We should not go a long way by neglecting that tuberculosis is not existing. Tuberculosis is existing, tuberculosis is real, and it's still the second killer disease. As we all know, it's still the second killer disease after COVID-19, following the statistics from WHO. So let's all be aware. Let's fight against tuberculosis. Let's see how we can prevent about tuberculosis for us not to become a victim of circumstance. Thank you so much. Please don't forget, for more health tips about tuberculosis, or in my next video I'll be talking about tuberculosis and HIV, that means co-infection. Why is it that so many people who are suffering from HIV, they are also suffering from tuberculosis? So in my next video, please, I will give you more health tips about tuberculosis and HIV. Please don't forget to follow me on Facebook on Dr. Blessings on Health Issues, and also to my YouTube channel, Dr. Blessing on Health Issues. Please subscribe to my YouTube channel, follow me, share my video. I'm here to create health, health, health awareness. Thank you so much.